Should access to something as essential as healthcare really depend on where you live or how much money you make? I want you to picture two women. One of them lives in the United States and one of them lives in Canada. Both of these women are pregnant and both of them need healthcare. Only one of these women can get access to the care that she needs, while the other woman is left to navigate a broken system. I want you to think of the women that you love, your mothers, sisters, friends. What if one of them needed access to life-saving reproductive care and couldn't get it because of how much money they make or where they live? This is unfortunately the reality for millions of women living in America. As an American woman myself, I've faced challenges within our reproductive system, and these challenges inspire me to want better for our country and to dedicate my time to researching a solution that would help to save the lives of all of these women. Canada's reproductive health policies are more effective than the policies in the United States, and today I'll walk you through why, from maternal mortality rates to maternity leave to abortion access. One reason why we should implement Canada's policies is the alarming difference in maternal mortality rates. The Canada Health Act defines Canada's universal healthcare system in 1984. According to the official website of the Canadian government, the Health Act states that their mission is to protect, provide, and restore the well-being of Canada's residents and to provide access to health services without financial or other barriers. Canada's comprehensive healthcare system guarantees access for all women, regardless of how much money they make or where they live. Canada also has a very low maternal mortality rate compared to other countries. According to the World Bank Group data, Canada's maternal mortality rate was approximately 10 deaths per 100,000 live births in 2021. To put these statistics in perspective, the United States maternal mortality rate in 2021 was 32.9 deaths per 100,000 live births. These statistics are unacceptable. The U.S. healthcare system relies on private insurances that often require women to pay out of pocket for their own health care. This financial burden can make it difficult for women to access proper care, and this lack of access has caused our maternal mortality rate to be one of the highest of the developed nations, according to WHO. I'll now walk you through the policies that reflect our standards of postpartum care. The lack of postpartum care can be seen in the lack of maternity leave benefits in the United States. Maternity leave is so important to allow mothers time to recover from something as intense as childbirth. According to the U.S. Department of Labor, the U.S. government has no federal paid maternity leave, though some states have implemented their own policies, but this doesn't guarantee the same rights and benefits for all American women, and especially impacts lower income women that can't afford to take unpaid time off after giving birth. Canada's government, however, offers 15 weeks of paid maternity leave, supporting the mother and her child's well-being. Now that we've seen and compared the way these countries care for their mothers, let's compare the abortion policies in these countries and look at how they affect women too. Canada and the U.S. have implemented vastly different abortion policies, and these differences have had a huge impact on women and their autonomy and health. Abortion laws vary by state in the United States, following the 2022 ruling that overturned Roe v. Wade, which protected our abortion rights. Some states have put total abortion bans in place, or bans that apply before 6 weeks of pregnancy, which is before majority of women even know that they are pregnant. Unlike Canada's healthcare system, ours doesn't provide funding for abortions, leaving many women with no way to provide funding for their abortions. This is due to the Hyde Amendment of 1977. According to Congress.gov, this amendment prohibits the use of federal funds for abortions except for in cases where the mother's life is at risk or in cases of incest or rape. However, this doesn't protect access for all women. While some states use state funds for abortions, the amendment impacted the lives of low-income women, especially women living in states with total abortion bans. These women might be forced into carrying out unplanned pregnancies that they can't pay for. But Canada's abortion laws allow for women to have bodily autonomy completely. Abortion is publicly funded as a necessary medical procedure in Canada's Health Act. Women don't have to pay out of pocket for their abortions, and they can access them regardless of their income. There is no law that restricts or criminalizes abortion in Canada. Canada's statistics on abortion also show us that allowing more access to abortion doesn't necessarily spike abortion rates. According to Gutmacher statistics, the percentage of pregnancies ending in abortion in Canada were 17%, and the U.S. was 16%. Despite Canada having more access to abortion, the rate is only 1% higher in the United States. In summary, the United States should adopt Canada's reproductive health care policies to guarantee better access to necessary health care for all women. We have failed to provide the resources that women need for their autonomy, their health, and their well-being. It's time for the United States to implement comprehensive policies that will guarantee access to reproductive care for all women.